The Gambia is seeing an increase in COVID-19 cases as a second wave of infections sweeps the continent and the world at large. A relaxation of lockdowns and the public's loosening of precautionary behaviors has seen recorded cases rise, forcing many governments to clamp down hard. The Director of Health Promotion and Education, Mamadou Njai, gives us the situational report as of today, January 20th, and tells us what they are doing to tackle what could be a possible second wave.
No, you're welcome. You can have a seat. Thank you.
Welcome to the Fatu Network, Mr. Njai. To start with, can you give us an insight on the situational report as of today?
With regards to the situational analysis for the 18th of January 2021, which is regarded as our 258th situational report. They are moving a lot, so we are having every day, or every two other day, we have the report. And this report indicates that we have recorded as a country 5 new confirmed cases of COVID-19 in the Gambia, bringing to a total number of 3,938 confirmed positive cases of COVID-19 in the Gambia. Of the 5 positive cases we have recorded, 2 of them have a history of traveling from a hotspot country. This doesn't mean that those 2 people are positive with the new variant, as many people may think. They are just positive, but the other procedures also are following. Because they come from hotspot areas, the investigation will still continue, and the sequencing will be done, and then the laboratory will get back to us with regards to the results of their analysis. Out of that number, 250 samples were collected, laboratory samples were collected and tested. As I mentioned earlier, 5 turned out to be positive. We used to have a less number of people who volunteer to test, but because also we are having, borders have opened, and people started traveling, airspace have been open, people started traveling, and it's a requirement before somebody travel, you must have to provide at least 72-hour PCR negative test result to the country you are going. But it has been a challenge for many because of the fact that now that we're having a large number of people that are coming, but our idea of encouraging voluntary testing is something that we have been talking about, but we still have seen a lesser number of people being tested. So having 250, last sample we also had was about 638 samples, and prior to that we also have about 407 samples that were collected. This is these are the trend, but it's also indicating that yes, we are having many people are also coming to test, which is also a good sign. Meaning the media and other people are also helping us in spreading the message for people to come out in their numbers to get tested. So this is something that we want to thank the public, but we want to say that we need to increase that number. Having about 2.2 million people, for example, in the Gambia, you have only about less than 40,000 people that have been tested. So you can see that's still something that we need to work on. So having you here, I am sure you're also going to be our advocate and as our ambassador in trying to encourage your colleagues, peers, and friends for them to, at least go for voluntary testing in the sites we have identified. That is the stadium, and also at the turntable and other sample collection sites we have also identified across the country.
So it seems like the Gambia at some point flattened the curve on the number of COVID-19 cases, and now we are seeing a rise as the world deals with a second wave. Is that the case in the Gambia? Do we call this a second wave?
Other countries around us are are experiencing the second wave because they almost flatten the curve. Basically, that also is a signal for us that we almost flatten our curve also, epidemiological curve, at the beginning, around October, November, and now we have seen a bit of an increase in the number of cases. We had a single digit at the beginning, but now we also have double digit. But now 16, 19, 21, and then now we have yesterday, day before yesterday, the weekend report, we had 23 confirmed cases. And then today we had a single digit. That was yesterday for the 18th of report for the 18th of January. We had 5 confirmed cases. Perhaps we might be there. We might get a bit down, or we might go up a bit. So we are monitoring the situation. And then what we don't want to go to a situation where we will register a larger number of people, larger number of cases at the same time. And if that happens, then that means we are going to be involved in firefighting, and we don't want to go into that. That is why we had to build our strategies. We had to strengthen the existing strategy we already put in place. That is why, key among them, we're trying to strengthen collaboration between the Gambian authorities and the Senegalese authorities. We recently concluded a meeting between Gambian authorities and then Senegalese authorities on the POEs, that's a point of entries, and how do we strengthen the point of entry. We also shared best practices. There are good things that are happening in Senegal. Equally also, there are good things that are also happening in Gambia. So we are able to share our experiences in those ones. So we are almost all ready in trying to make sure that we flatten the curve. This is something that is already ongoing, and we are happy that the cross-border collaboration is being strengthened. We also strengthen capacities of our existing staff in the areas of case management, in the areas of surveillance, at the laboratory, and as well as also contact tracing and rapid response. We've also increased our areas of strategy of risk communication and community engagement, and then these areas have been strengthened. We know that we have been doing a lot of work in this area, so what we did was to re-strategize our interventions. And then we also make sure that we engage the local authorities. This is all part of our plan. Knowing that we might go into a second wave, we are not also declaring at the moment to say we are in the second wave, but we might go into it. So before we go into it, we need to get prepared. And that's why we were in this, we are prepared since day one. And now what we are now doing is to review our actions we have been taking, our strategy we have been applying, our approaches, and see which areas, and in fact to identify the gaps and building on our strengths in certain areas. So this is exactly what we are doing now.
And as far as the new variant is concerned, what do we know about that?
These are 2 confirmed for now. As I said, the other 2 that has been reported yesterday, they are not confirmed for the new variant yet. We are getting, but they are they've been tested positive for COVID-19. And then the investigator will still go further to see, after maybe when the sequencing is done, and then the laboratory scientists will do their job, and they come back and tell us which of the categories they fall into. The 2, as I speak to you now, they are receiving treatment at the treatment center, and they are responding to treatment. But when people heard about the new variant, the UK variant, which spread very fast, and then can kill faster, people were really panicked. And I think there were a lot of calls all over. People were worried. Many people decided to cancel their flights before they come to the Gambia. Because we have been following the communication in our Facebook page. And then we want to assure the public that with regards to those particular cases, the ministry have responded very well. Because we were able to locate them or track them as a result of our surveillance at the airport. That is why the issue of the mandatory quarantine was very helpful, because if we didn't put up those measures at the airport, perhaps we would not be able to detect them. So we were able to detect them. They've been tested, and they're proven to be positive, and they've been taken to the treatment center, and they are currently responding to treatment.
How effective is this mandatory quarantine? Because we've been hearing allegations from travelers visiting the country. Recently, someone reached out to the Fatu Network and said they were dumped at a hotel, and the only people who didn't go through the mandatory quarantine were the people who were able to pay their way out of the hotel. How do you respond to these allegations?
Actually, yes, we are also aware of some of those allegations. We are yet to verify, and when there are allegations, you must investigate. We will investigate those allegations and then find out whether they are really the realities on the ground. If yes, actions will be taken against those authorities. But also, I want to remind you, we are used to some of these actions from the communities or from the people traveling. Remember at the beginning when we had put up measures for quarantine, we had a lot of allegations. Our staff, we have been alleged to be doing all sort of things, so corruption scandals and all those things. But those allegations came as a result of the fact that we have realized that many people don't want to go to quarantine. And the only thing they can do is to tarnish the image of our staff. Those hardworking staff, those committed staff, at the airport who have been there having sleepless nights. Some of them have been harassed, but they all kept calm and quiet and then they concentrated on their work. They've received all sorts of, abusive languages. They've been, harassed. Some of them, to the extent that we've been trying to, almost getting to them to attack them. But they've been maintaining their positions that they have to go to quarantine. So if somebody travels outside and then comes to the government, we've been asked to go to quarantine, the psychology, in fact, the fear of quarantine alone, people decide to say all sorts of stories about but we will investigate those allegations. The ministry will do that and then get back to the public on that. If they get the information, we will definitely get back to the public and inform them. When it comes to quarantine, we said it's a mandatory quarantine. But why people are also scared now, because they thought the mandatory quarantine is 14 days. In our press release, it is not indicating that we are going to keep them for 14 days. So when they come to the airport, despite the fact that they are coming with a negative test result, PCR negative test result, they still have to go to mandatory quarantine because they are coming from hotspot countries. That has been highlighted in our press release. And the press release also indicates that each of those people have to be responsible for their own cost. There's 2,300. But many thought that is 14 days. That is why there was all sort of noise around. Oh, I cannot pay this now. This is too long. Or I'm here for a wedding, or I'm here for a funeral, or I'm here to see a sick person. So I cannot be here for 14 days. Perhaps they did not understand or they did not read through the press release. The press release clearly states that you'll be taken to quarantine, mandatory quarantine. When you are taken to that quarantine, your sample will be collected and taken for analysis. And then when your results is negative, then you'll be discharged to go home and meet your family. And if you are positive, then you go to the treatment center. Whether asymptomatic or symptomatic, you still have to be taken to the treatment center. That is what is clearly stated. And we want to assure people who are into business, people who intend to travel to the Gambia, that they should not cancel their flights because of this mandatory quarantine. The mandatory quarantine at most will be 24 hours. Like when you are for example, you travel with SM Brussels and you arrive in Banjul at 8:45, for example. And then before the procedures, before you complete the airport formalities, it might take some time. So therefore, you might arrive your hotel be around 10, 11. So by the time you reach there, then the lab will not be available, will not be able to come to the hotel at the time. But in the next morning, they'll be there to collect their samples. And if they collect your sample at that time in the morning, the following day you get your results. And if you get your results, you are negative, you are allowed to go home. So meaning we can say 24 hours at most. But some people also, yes, they said they've experienced long waiting hours before the sample collection teams come to collect their samples. We have discussed this, and we will rectify if there are gaps on our side. And if any of the travelers were offended with this, I think we will have to apologize in this area. That is not our intention as a ministry. Because we may also have some challenges here and there, either because we may have the staff that are covering there, may have a lot of areas to cover. The hotels, maybe there are between 3 to 4 hotels, and the passengers could be reached of about maybe 100 to 200 people. So maybe only 4 or 5 people or 6 people doing that might be. So maybe they may have started from one hotel, and they are moving to the other hotel, and they move to another hotel. Perhaps that gap may have caused inconveniences on some people. Maybe the last hotel that they are supposed to go, they may not reach there on time. And they were expecting them, they were expecting that, they might be expecting that they'll be going there in the morning. When they end up reaching there around 2 o'clock or 3 o'clock, perhaps this were some of the inconveniences. But we want to apologize if there are inconveniences. We are trying to adjust. As I said, COVID is a situation whereby every day we learn something. So as we are moving on, we learn, and when we identify challenges are there, we identify them and see how best and we see how to respond to those challenges. So I think we have some gaps at some point, and then we're happy that the public, when they feel that we are not satisfying their needs, they can come up, but it has to be done in a way that it should be professionally done. It should be done in such a way that it doesn't, it will not create some, sort of confusion, between the two parties. So if we have issues, we have a Facebook page, and we are happy that we are responding to queries and concerns, of the public during our Facebook page. They can also call out 1025 and raise concerns, rather than having videos taken at the airport, talking to people who are angry. And sometimes we do have to, look at the way we also report at the airport. Some people, you just go there to look for fault. But in actual fact, Ministry of Health is doing a lot of work. We are doing a lot of work in implementing public regulations in any country. It is not easy. So one side must be offended, and the other side also will look at the interest of the public. So when we talk about public health, we are looking at the interest of the public. So we are not here to impose things that will cause a lot of confusion or cause problem or trouble to people. But we are here to protect them and the people they are going to. Because, for example, where you're coming from, we don't know your status. So if you come now, we allow you now to go and interact, knowing that you are coming from travel. Sadio, in this country, once you travel, even just to go to Senegal, you come. You have 2-3 visitors coming to say, hey, hello, how are you? How was your trip? Much more somebody coming from Europe. You expect to have a lot of visitors. And you'll be contacting with those people. That is why we are protecting those visitors, your family, your immediate family, and yourself, and the entire population. So we want to appeal to them. We take it easy with our staff at the airport. We have well-trained people at the airport, disciplined people, hard-working and committed people. And then they have been working 24 hours around the clock. And I think sometimes it's not easy. So let them understand. If they have challenges, they can easily go to them. But if you come from the airport, they ask you to go for quarantine, then you get angry, then you start talking to them in an angry mode. That cannot solve your problem. We want to appeal to them, talk to them nicely, raise your concern nicely. I am very sure the issues will be addressed. That's the appeal I want to make to people who are traveling in the country, into the country, for example, coming from, not only hotspot country, but people who are traveling, into the country, and also people who are traveling outside the country. When they come to collect their certificates, you can see, even, some days here, they come and harass our staff here, just to collect a certificate. But you know that your sample is collected, for example, in the morning. And then they ask you to come at 2 o'clock, and you decide to come at 8 o'clock. Then you start from long queue or maybe everybody start to control at our gate. Sometimes getting into our office it's a big challenge for us sometimes. But we have to be with them and talk to them. And we'll continue talking to them, to explain to them what we want. Because if your sample is taken in the morning, we expect you to come out between 12 and 1 o'clock or 2 o'clock. Because the sample have to be processed. The processing takes some time. Sometimes when the samples are many, for example, 600 samples, for example, and the tray, for example, takes about 100, the minute they have to take the tray inside, maybe 6 times. So some of those, so if your result doesn't fall into those ones, it becomes a challenge. So meaning you have to wait for a while. But at least we make sure that people get your test results a day after when they get the samples are collected, which we are really improving on that. It used to be 3 days or 4 days, sometimes 1 week. And that was the beginning. But we improved gradually. So I think it's something that we want to appeal to, And I'm sure some people may be offended, they might not be happy with our system. Yeah, because this is the first time some people are experiencing, in fact, we're all experiencing a pandemic. But when it comes to epidemic, we all know many people have an experience, some people have an experience there. But this pandemic, every day is a learning process for all of us. So we are learning and we are identifying the challenges, and with their support, we can be able to move the agenda forward.
So every day is a learning process, and people say COVID-19 is here to stay. The medical experts have been scrambling for a year to find a vaccine for the virus, up until recently when we had a breakthrough. How is the Gambia government trying to access a treatment for COVID-19 And if so, which one are we opting for?
Actually, we are strengthening the case management. The doctors, the capacities have been built, and then we are also having facilities to be open in the Bansang and Soma. These are the treatment centers, and as well as North Bank West, and in addition to Ndemban and some 1 or 2 hotels, and as well as to addition to Venture, which is the sanatorium. That's for the side of treatment. And then we got the required equipment and then materials that are supposed to be there, especially at the sanatorium under the coordination of Dr. Bakar Jain and his team. They're doing an excellent job at the treatment center. And then when you come to prevention now, that's about vaccination will be one of them. And then, as you know, there's a lot of talk about the vaccine. And the Gambia government and the Minister of Health will never give any vaccine to any individual that has not been proven to be safe. So any vaccine we are giving to people, it's going to be a safe vaccine. Imagine we are going to start with health workers if the vaccination should start. Meaning that we are telling people that we are taking it ourselves. So that should be assurance from the Ghana public. That's one aspect of it. And also we know that because many of our health workers get contact with other people. So protecting them at the initial stage will be our priority for now. But also our intention is to vaccinate the entire population. But perhaps the resources will not be adequate at that time, and I'm sure government will chip in. That one I'm very sure of that. And then we're also working, the ministry is working very hard with the partners like World Bank, Gavi and others, at least to make sure that at least vaccine is available for each and every individual in this country. And then we will also communicate to the public as to the target population for the vaccination. Because every vaccination program has a target. The age group, for example, you are targeting. Every vaccination program have that. So we have already developed the vaccine plan, and this vaccine plan contains a lot of things like the logistic arrangements, the coordination, the management of in case of there is any effect as a result of the vaccination, and also the communication and community engagement components. Each of those have been categorized in the plan. It has been costed, and now we are now waiting for the availability of the vaccine at country level. If the vaccine is available, we'll get back to the public to say the vaccine is available in country. And the time we are going to start the vaccination program also will be communicated to the public. And we will develop messages and materials around the vaccine itself. Looking at the safety, looking at the age groups, and then maybe the intervention areas. All those things will be identified in our message booklet. And we will use that now. We will give it to the media also to now help us to start sensitizing the public. Because knowing that, from our experience as a sector, anytime we want to introduce new vaccines, there are misconceptions around introduction of new vaccines, or there may be rumors around the vaccination, and that will cause a bit of crisis. And that's why a few of us have been trained on the crisis communication and rumor management, so that when there are rumors around anything, we also try to respond to those rumors as they occur. And then, looking at misconception, I'll give you a typical example. We had one vaccination program, the tetanus toxoid vaccination campaign in 1995. There were a lot of resistance. People say it's a family planning means of family planning trying to cut down our population. And because we were targeting young girls at the time, it was a big challenge for us. But after rigorous communication, we were able to address those barriers. But even with that, we were able to go back to those communities, even after 1 year, about 2-3 years of vaccination. And we have realized that most of those girls that have been vaccinated and they are married, they will all end up having children. That's a typical example. And then we are just tell them that whatever we are doing, introducing to the Gambian population, we are not going to introduce something that is going to cause harm for the population. Same thing we have for the meningitis campaign. We had an outbreak in 1997 in which many people lost their life, and then particularly Upper River region and Central River region and part of North Bank. We ended up having the MenA vaccine in 2013. The introduction of that vaccine also has been a challenge. There were a lot of misconceptions around the vaccine, but with rigorous communication, we were able to address it. And even we were able to increase demand for the vaccination, and people were even calling us to say they are interested in getting vaccinated. So we will do the same thing. polio also, you know about the polio vaccine. When we started, it has not been easy. We had a lot of rumors around the vaccine, and also we also got a lot of misconception around the vaccine. So we were able to break the barriers. And then at the end of the day, there were, demand for the vaccination was really on the high side. So likewise for COVID, we started talking to the media now so that when it is available, we are going to use it because we already got the WHO approval. And we also want to remind the Gambian population, several vaccine trials have been conducted in this country and West Africa alone. And then key among them, the main A vaccine, you have the hepatitis, the pneumococcal vaccine. They were all tried in this country. And other countries like Guinea-Conakry, Mali, Burkina Faso. These are the countries that we are there because we were, for the meningitis, we were in the meningitis belt at the time. So all those vaccines have been tried. The hepatitis one was tried in the Gambia here. And now we are giving it to children. And that is why we have been able to cut down the number of children that have hepatitis. So you can see that these vaccines are very helpful. So likewise for the COVID, we are going to do the same thing. We're going to raise awareness. But we also want to make sure that we focus on identifying rumors around the vaccine and responding to them and addressing those rumors, and also identifying misconceptions around the vaccine. What are the typical misconceptions that we were seeing or we are expected to see, and we also prepare for that. So the vaccine plan contains all those things. And we also put up a communication, social mobilization and advocacy components, and as well as community engagement. Why we are engaging the community, we'll be engaging the community is that first we start with the district chiefs. We have about 40 of them in this country. So each of the district chiefs now, after the engagement, we expect them to go and engage their village heads. And that's what we have been doing in the previous campaign, and it has been proven very much successful. So as a result of that, district chiefs are going to engage village heads. And as I tell you, we have about 1,889 villages in this country. So if all the district chiefs were able to engage all their district village heads, automatically we were able to reach out to all those villages. And then all the village heads also go back to engage their household heads. And all the household heads also engage their family members. So I think, Sergio, by doing that, we'll be able to reach out to the population. And then, in fact, now, when we do that now, we are now trying to inject the message into the populations for them to know the importance of the vaccine. And we want to tell them that the ministry will only introduce vaccines that have been proven effective and safe by the World Health Organization. And when approvals are done, the Ministry of Health will still have no other option but other than to implement the administration of vaccine to the general public.